2021. I'm Adam Sotak, the Public Engagement Director for NC Child, and really looking forward to our guest speakers today, and we're going to introduce those to you in just a minute. Before I do that, however, I wanted to let everyone know, as a reminder, this is a bilingual meeting. So the session's completely bilingual in English and Spanish, and we have a live interpreter on the line. Everyone will need to choose either the Spanish or English channel to hear the audio. If you do not choose an audio channel, you will not be able to hear the presenters. To choose a channel, look for the little image of a globe and the word interpretation at the bottom right of your Zoom screen. Click that and then choose Spanish or English. If you choose the Spanish channel, you will hear the interpreter speaking in Spanish. You'll also be able to hear the English language presenters at a low volume in the background. If you do not want to hear the English in the background, you can click the globe icon again and choose to mute the original audio. And presenters, this is for you. If you can, please be sure to try to speak a little bit slower if possible, so that our interpreter's job is made a little bit easier. And for everyone, we have a lot of participants on this webinar, and so we're going to keep everyone on mute to preserve the audio quality. But feel free, this session is being recorded, and feel free to drop any questions, comments you have in the chat box, and we will do our best to get to those and get those answered. Okay, so let's get started. All right, so today we are very glad to be discussing and providing a sneak preview to our 2021 Child Health Report Card. This is a publication that NC Child is proud to co-release with the North Carolina Institute of Medicine. And today we have Kathy Colville, who is the president and CEO of the NC Institute of Medicine, along with James Coleman, who's a research specialist with NCIOM. And they, along with our own Vikki Crouse and Fawn Pattison, are going to talk about this important report card and what it is showing us related to children here in North Carolina. After that, we will be hearing our weekly legislative update from our lobbyist, Ashley Perkinson. There's been a lot of bills filed and a lot of things happening that she'll be able to report on. And then Kaylan is going to give us an overview of some exciting proposals at the federal level that may be moving forward related to Medicaid and Medicaid coverage. Last but not least, we can always have announcements and then adjourn. So without any further ado, I would like to go ahead and get us started on the Child Health Report Card presentation. And Kathy, since your name is first, let's start with you. That works.
Thank you so much, Adam. Can you hear me okay?
Yes.
Okay, good. That means that I've chosen the right thing on the globe. I appreciate that so much. Thank you for the introduction, and thank you for the music to get us all started. I'm going to have to go listen to music after this. My name's Kathy Colville. As Adam mentioned, I'm the president and CEO of the North Carolina Institute of Medicine. I'm going to start off our discussion today of the 2021 Child Health Report Card, but I do want to recognize the really diligent and thoughtful work of our partners at NC Child, with whom we've collaborated on the Child Health Report Card since 1997, which is exciting. Special thanks to Vikki Crouse and to James Coleman, and I also want to acknowledge Fawn Pattison, Michelle Hughes of NC Child, and Michelle Reese of NCIOM for their contributions to this project as well. So all of us here on this call share a dedication to the children of North Carolina, and I believe we also share a belief that we should, as leaders in our communities and our state, hold ourselves accountable to measurable improvements in children's well-being. North Carolina's children need and deserve our very best efforts to create policies and systems that will help them realize their potential, chase their dreams, and make their own meaningful contributions to their families, our communities, and the state. The Child Health Report Card captures our progress at a point in time for 15 indicators of health and well-being across 4 domains. Those domains are secure homes and neighborhoods. I forgot I need to talk more slowly. Secure homes and neighborhoods, access to care, healthy births, and health risk factors. This year, the Child Health Report Card also includes information on the impact of COVID-19 on children and families and points us towards actionable steps to recovery. So I want to be real. I think many of us on this call want to do well on report cards. For some of us, the term report card makes you shudder, and other people get really excited about it. This document provides us with the opportunity to take stock of where we are at this point in time, to understand what's working well and where we really need to focus our efforts. You know this already, but we have serious work to do in North Carolina for our children. James Coleman is going to share brief highlights of the data, and Vikki Crouse will share additional analysis and recommendations before we get to the Q&A. But before James begins, I want to tip you off to some areas of special attention. North Carolina got an A in insurance coverage, with 94% of our children in our state having insurance coverage. And that's important and that's wonderful. And we also need to keep our eye on this because this rate of insurance coverage for children has started to decline just a little. And we need to make sure that we continue to shore up that fundamental tool for children's well-being. We also want to draw your attention to the health of our youngest children and the challenges that we continue to face in North Carolina with infant mortality rates, and especially to racial inequity and health outcomes for babies. At the other end of the age spectrum, we see in these data that our teens are struggling with mental health, including an alarming increase in the number of high school students who report having attempted suicide in the past year. We're now at almost 1 in 10. So we believe that while this information is very sobering, this document also represents hope and our fundamental belief that we can make change and that we can make a difference in the lives of North Carolina children and families. But we need to know where we are and we need to get to work. I'm going to turn it over to James now for our data highlights.
Thank you, Kathy, for the introduction and that wonderful overview of what's included in the Child Health Report Card. My name is James Coleman. I'm a research specialist with North Carolina Institute of Medicine. As Kathy mentioned, I'm just going to go briefly over some key highlights from the 4 domains included in the report card and just kind of touch upon where we've kind of made great strides when it comes to children's health in North Carolina and some areas of improvement where we can continue to make progress. Next slide, please. So Kathy kind of gave a great overview of this, so I'm not going to spend too much time on this slide. But as she mentioned, we have 4 domains covered in the report card on healthy births, access to care, secure homes and neighborhoods, and health risk factors. And quickly for each one of these domains, I'm going to share 1 or 2 highlights. Next slide, please. So for secure homes and neighborhoods, we have seen a 35% decrease in children who live in high poverty neighborhoods. So we're making great progress here. However, disparities are present. So 20% African Americans and 21% American Indians live in high poverty neighborhoods compared to 3% of white children. So as I mentioned earlier, overall, we're making great progress, but continued work is needed to address the systemic issues that are leading to the disparities. Next slide, please. So for access to care, we are seeing great numbers when it comes to HPV vaccination among 13 to 17-year-olds, a nearly 24% increase over about a 2 to 3 year period. And also we're seeing encouraging numbers when it comes to the number of parents with health insurance coverage. However, disparities exist with that as well. 50% of Hispanic households of parents do not have insurance coverage compared to 9.3% of white parents. And this particularly, we have to be conscious of the disparities as we go further and further into the pandemic, as parents continue to lose their employment, and we see increased levels of the uninsured. So we just need to be cautious with this and continue to make progress where needed. Next slide, please. So for healthy births, between 2014 and 2019, we have seen a 25% decrease in the rate of births of teen girls between the age of 15 to 19. So we're making great progress there. Now, when it comes to infant mortality, even though I've seen a slight decrease, a minimal decrease in infant mortality over the past couple of years, disparities, especially for African Americans and American Indians, is just stark. Nearly double that, more than double that it is for white infants. Next slide, please. Now, for health risk factors, this is an area where there is much room for improvement overall for all the indicators listed, but we can find some areas of encouragement, especially among alcohol and tobacco use. We've seen a decrease in that over the past couple of years. However, when it comes to rate of vaping, of use of vaping product among high school students, is very discouraging. We've seen a 60% increase between 2017 and 2019 in vaping usage among high school students. However, I must add, this data was collected before federal policies to address this issue were implemented, mainly raising the age to buy tobacco products for the age of 21. So I just had to note that. And that could affect these numbers in the near future, but we should still work to make progress where needed. Additionally, as Kathy mentioned in her introduction, mental health issues among our youth, especially our teenagers, are very concerning. We've seen a 25% increase in the number of adolescents aged 12 to 17 who have had a depressive episode in the past year. And that's over the past couple of years. And that is particularly consequential because nearly 1 in 10 high school students have attempted suicide in the past year. So with that, that was just the highlights from the 4 domains that Kathy mentioned we will go over. And if there are any questions, I look forward to answering them during Q&A. And now I'd like to hand it off to my colleague, Vikki Crouse, who's going to give us an overview of the Child Health Report Card special focus on how the COVID-19 pandemic is affecting North Carolina families.
Thanks, James. So we can move on to the next slide. Okay, great. So yeah, as James mentioned, the special issue, of course, we really wanted to take a look at how the pandemic has touched the lives of North Carolina families. And the reality is that we know it's touched the lives of every family in the state. As many families try to find their footing, the pandemic has really put a harsh spotlight on the deeply embedded barriers that create massive racial and economic inequities in health and well-being. Children, we know, are quite resilient by nature, but when parents lose a job or their income, as so many have recently, it can cause a cascade of other traumatic events for children. Losing a home, skipping a meal, or having a parent struggling with depression or anxiety can result in serious long-term consequences for kids. Before COVID-19, nearly half of children in North Carolina already lived in a family that was struggling with poverty. Now we know many more families are having a hard time meeting their children's basic needs. And I want to note that our main data source for the data that we included in the report comes from the Census Bureau's Household Pulse Survey, which has been a really great resource for folks across the country. It was originally launched in April of 2020, and it has provided nearly real-time weekly data on how the health and economic crisis is affecting the nation. The survey asks questions about how jobs, finances, access to food, housing, and schooling of children is going during the crisis. And the Census Bureau is currently in their 3rd phase of data collection, which will wrap up in March. And the data that we included in this report card is specifically from the week between November 25th to December 7th, just for some context. So as you all know, things have worsened throughout the year and might look slightly different even now if we were to look at the data. This data really provides a starting point for a path to recovery in North Carolina. The extent of continued hardship for families is really going to depend on whether relief is robust and reaches those in need, as well as the trajectory of the pandemic and the pace of economic recovery. So we can go on to the next slide. When it comes to family economic security, we know that the pandemic has really rocked the financial situation for many low and middle income families across the state. According to data from the Pulse survey, almost half of adults in households with children reported that they are struggling to pay for usual household expenses during the pandemic. The Pulse data also show that tens of thousands of North Carolinians are not caught up on rent or mortgage payments. Approximately 1 in 4 families with children struggle to pay rent. And when we look at the data by race and ethnicity, we see that 30% of Latinx families are behind on rent payments and 18% of Black families are behind on rent, compared to 15% of white families. Although households with mortgage payments typically have higher incomes than renters, they too can face difficulties, especially if they have lost their jobs or have seen their incomes fall significantly. So the data shows us that a fifth of homeowners with children reported being behind on mortgage payments. Across the country, that translates into an estimated 10.3 million adults in a household that is not caught up on their mortgage payment. So a lot of folks are on the brink of eviction. And hunger continues to be an urgent threat in North Carolina, even in the best of times. Food insecurity can mean being worried about running out of food before your next paycheck, cutting the size of children's meals, or skipping meals entirely, all because there wasn't enough money to buy groceries. Even before the pandemic, North Carolina had the 10th highest rate of food insecurity in the nation. Presently, 1 in 5 households with children report not having enough to eat over the past week. And when we look at that data broken down by race and ethnicity, we continue to see racial disparities. We see that a fifth of Black households and a little over a third of Latinx families reported sometimes or often not having enough food to eat in the last week. And that's compared to 16% of white households who reported the same. So there's a lot we must do to close this gap and ensure that every child has access to affordable and nutritious food. Next slide. COVID-19 is also changing the way that children receive education across the state. Distance learning is a critical tool to help prevent the spread of COVID-19. And although we know that students and teachers are both eager to get back in the classroom, we care about our teachers and our students, and we want to keep them safe. So until it's safe to go back to the classroom, we have to ensure that students have the tools that they need to learn at home. And while most households with children have turned to full-time or part-time distance learning, approximately 67%, access to internet and computers remains a challenge for many families across the state, particularly for low-income households in rural communities. And that can translate to poor or failing grades when kids don't have the tools and supports they need in school. As of the last figures, we know that approximately 200,000 households with students still didn't have access to broadband internet in North Carolina. So there's much that policymakers need to do to close that gap. All right, next slide. And looking at health, we know that in order for kids to have a strong start in life, it's all about that preventative care. So making sure that kids are going to their well child visits and getting immunizations and dental cleanings is really important for ensuring their long-term health. Unfortunately, we know that a lot of adults have delayed getting care for themselves and their kids due to a fear of COVID-19 in the doctor's office, but also because they may not have health coverage or may not be able to afford it. DHHS noted a trend in the spring of last year of a dramatic drop in vaccines administered in the state's immunization registry. And the concern is that we can't build herd immunity against diseases like the measles and the mumps without at least a 93 to 95% vaccination rate. And we obviously don't want to see an outbreak for diseases that we immunize for in North Carolina. And so what we see in the data is that almost half of adults in households with children have delayed getting medical care because of COVID-19. So that's really concerning. We also know that losses in employer-sponsored health coverage for folks who have lost their jobs have meant that families can't get the care that they need. And what we're seeing is that more than half of parents reported struggling with anxiety and depression symptoms and had not received mental health care for those, to treat those. So that can put families in a really precarious position when parents aren't healthy and able to care for their kids. And racial disparities persist, and particularly when we're looking at healthcare coverage, Black and Latinx children have the highest uninsured rates among racial and ethnic groups. All right, next slide. So the question really is, what can we do about it? And a lot of it is a repeat of what we've been advocating for over the past year. Now, as the state legislature convenes for the 2021 long session, policymakers really have several opportunities to address some critical points for children's health in North Carolina that are highlighted in the report card and the special issue. So firstly, strengthening health coverage as a crucial part of North Carolina's public health response to COVID-19. Expanding access to affordable health coverage for adults and kids alike is important for children's physical, mental, and emotional health. When parents are insured, they're better able to stay healthy and care for their kids. And likewise, children are more likely to have health insurance and use it. Without health insurance, it can be nearly impossible for parents and caregivers to get health care when they need it. and also preventing long-term harm to kids by investing in the programs that are proven to insulate families against the harmful effects of poverty. Programs like Medicaid, SNAP, WIC, and high-quality early education are proven to boost school success and help keep kids healthy throughout their lives. And finally, expanding access to broadband internet. State legislators have an opportunity to get internet to an estimated 200,000 homes with students that still have no internet access. Currently, these families don't have the Wi-Fi access they need for their kids to attend class remotely, but also they often can't use telehealth services, search and apply for jobs, or apply for vital benefits like Medicaid or SNAP, particularly during the pandemic. So it has a cascade of other consequences for families when they don't have internet access at home. But with that, I conclude the presentation on the Child Health Report Card and some of the opportunities for legislators, and I'll turn it over for some questions if anyone has any.
Thanks so much, Vikki, James, Kathy, for that presentation and overview of the report card. Let's see, Fawn, do we have some questions? Any questions?
Yep, great question from Rachel Radford for the team. Are you all seeing differences in all these statistics in rural versus urban suburban areas?
That's a great question for the Pulse survey. They don't capture like geography, I guess, more at the local level. So unfortunately, we don't have up-to-date numbers on the impact of the pandemic right now.
And as we're talking about previews, we will have the county data cards coming out in March. So we'll get a little bit more of that perspective on different counties, rural versus urban, at the end of March when those county data cards come out.
That's right. And even more so, I would say next year, because with the county data cards, it's always like 2 years prior. So we're still not going to be able to see the impact of the pandemic, but we can assume that it's going to be a lot worse, unfortunately.
Can you all touch on there's a question from Anna Casey. Could you all touch on the suicide rate again, please?
Yeah.
Sorry, the specific question was, when were the data collected? I apologize.
That's a great question. I can look up the data source really quick and find that year, unless you beat me to it, James.
Yeah, thank you for the question. And the data years, the most current year is from 2019.
Okay, perfect.
And can
go ahead, sorry.
And
I was just going to follow up on that. If you could discuss racial disparities as a follow-up question in those data, gender, ethnic, anything that you all are seeing in terms of disparities in the youth suicide data. Sorry.
Yeah. And Valerie, thank you for your question. And unfortunately, for this particular indicator, there is no data disaggregated by race that we can share with you all.
The data source for that is the Youth Risk Behavior Survey. Is that correct?
Yeah, it's a national survey, I believe.
So we could share the data source with folks if they're interested in digging deeper into that.
Absolutely. We'll be releasing the data sources list along with the report card when it goes live next week. And I believe all of those are hyperlinked, so you can easily find the data source and explore more of the data for sure. One thing we've thought a lot about when it comes to youth attempts in suicide and depression and substance use is the impact of being at home more this year, and whether that'll mean that, you know, parents have either been able to supervise their children more, but of course we know from news reports that kids are definitely feeling more depressed, not being able to see their friends and not being able to be in school. So on the one hand, it could have a positive impact on substance use. On the other hand, we may see higher levels of depression coming out of this pandemic.
Yeah, I just wanted to point out with the Youth Risk Behavior Survey that is part of the reason for the lack of disaggregation is sometimes the way that the data are collected, and that is collected by self-report by a survey that's given in the school districts that choose to participate in North Carolina. So unfortunately, we often lack sometimes local data for the areas that we're most interested in if your school district hasn't participated in that, but it does give you a snapshot of the state as a whole.
And just want to point out, Michelle Reese is commenting that we have seen in previous report cards higher rates of suicide ideation and attempts among LGBTQ youth. And that's one of the places where we just see the enormous disparities is for youth who are experiencing higher rates of all kinds of other suicide risk factors as well. All right, not seeing more questions come in, but we are going to send out the child health report card, the data sources, a quick one sheet, all of those things next Tuesday, February 16th. That's the official release date. We would love your help with getting the word out about that, everybody. If you're seeing the issues that you work on reflected in these data, then please jump on, use this as a way to promote the important work that you're doing in your communities. We want this to be a useful tool for you. So we're going to be giving you a toolkit, and I'm actually going to send it out in the follow-up email that we send everyone today. A toolkit that you can use to share the child health report card on your social media, in your newsletter, your blog. If you want to send out a press release, you'll have everything that you need to do that. If you, we'll be working on getting media coverage in your local areas, send a follow-up letter to the editor. We'll have lots of tools for you to be able to do that. And I will send that toolkit out today in case you want to pre-schedule any social media, but none of the links will work until next week on the 16th. So don't send anything out yet, but we'll have everything you need in that toolkit today.
Thank you, Adam.
Absolutely. Thank you once again, James, Kathy, and Vikki. Okay, moving on now. Next, we are going to hear from Ashley Perkinson, the NC Child lobbyist, who is going to provide a weekly legislative update for us. Hey, Ashley.
Hi, Adam. Good morning, everyone. So education continued to be a top policy priority this week in Raleigh. Several news items there. I want to start off with mentioning the announcement this week from Governor Cooper that teachers and child care staff will begin being able to get their COVID vaccine starting on February 24th. DHHS on its COVID dashboard has all the information for those details, but that is great news. As we're continuing to move to group 3, other essential workers and other frontline workers and essential workers that aren't already covered will hopefully be able to come online and get their vaccine starting March 10th. So progress there on the vaccine front. Also want to update everybody on Senate Bill 37. That is the bill that we discussed last week that would require that school districts provide in-person learning for students in public schools. There is still the option to do the remote learning, but this would require that the in-person learning be an option for students. That bill has passed both the Senate and the House. However, they passed in different forms, and the House inserted some language to provide reasonable accommodations for teachers that have concerns with health issues and would prefer to continue to stay remote. But because there are changes or differences in the House version and the Senate version, that bill has been sent to conference committee, but I anticipate that they will likely work out those differences likely next week. The list of conference committee appointees have been named, and if you go to ncleg.gov and click on the bill, Senate Bill 37, you can see that full list of conference committee appointees on both the Senate and the House side. Also want to mention a bill that we talked about last week, Senate Bill 36, and this is the bill that would provide additional COVID relief. Part of the bill, as we talked about, makes those technical changes to extend the deadlines, but other parts of the bill would provide some significant federal funding. The governor did sign that bill into law this week, and I'll just mention again, it would provide an additional $1.6 billion to K-12 schools. As we talked about last week, there's not a lot of detail in the bill, but the discussions regarding the 1.6 have really focused on the summer school programs and also mental health supports, as was highlighted earlier, the significant concerns for increased mental health concerns with our kids as we continue to battle this pandemic. Also, that legislation includes that extension for the 335 extra credit grants, nearly 95 million for COVID preparedness for vaccine distribution and preparedness, and then 546 million in emergency rent relief and 155 million for local governments. And also, as we talked about earlier on the Zoom, the significant need for state investment in rural broadband. This bill does include 39 million to expand rural broadband, and that will continue to be, an advocacy effort to continue to provide that state investment in those areas that have significant needs for broadband support. Also want to mention House Bill 61, Representative Donna White introduced a bill to provide 36 million in state funding to our local health departments. So that would go to both communicable disease support and to support the infrastructure of local health departments throughout the state. There was also some good news to share this week. We got the report, as we've been highly anticipating, the revenue forecast from this. This was really a joint effort from the fiscal division at the General Assembly and the Office of State Budget and Management. So thankfully, the revenue projections exceed those May projections, which were really dire, by around $4.1 billion. That's a 17.6% higher revenue picture than what we were concerned about several months ago. So that provides some good incentive for the legislature and the governor to be able to put together a strong state budget for this new year. Also want to mention some other good news coming out of Congress. Representative Alma Adams introduced what is being called the Momnibus bill, and that bill is really a package of 12 separate bills, but it is really focusing on Black maternal health. As most of you on this Zoom call know, just the really terrible statistics of concerns for health of Black moms, that they are 2 to 3 times more likely than white moms to die of pregnancy-related complications. And so this bill would work to help address some of those disparities. It includes investing in social determinants of health, studying the unique maternal health risks, improving data collection, investing in digital tools like telehealth to improve maternal health outcomes, and investing in federal programs to address the unique risk for and effects of COVID during pregnancy as well. Also want to mention some back to the state legislature. As Adam mentioned, a lot of bills are rolling in. We're up to 72 bills on the House side and 92 bills on the Senate side. And I don't know why. I'm kind of surprised that the Senate has more bills introduced than the House so far. That was surprising to me. But just yesterday, there were a number of bills introduced on the Senate side related to recommendations by the Child Wellbeing Transformation Council that probably a lot of you followed when it was meeting. So that group, and that was a group of both legislators and stakeholders that are involved in child policy. But that group put together its report. Several bills were introduced. I'll just mention, I'll just go down the list. Senate Bill 86 is an act to ensure awareness of school-based health services that are reimbursable under Medicaid, and trying to make sure that if there are services that can be reimbursed by Medicaid, that schools are aware of those resources. Senate Bill 87 would allow charter schools to receive Medicaid reimbursement, the same kind of Medicaid reimbursement as LEAs. Also, Senate Bill 89 would provide regional supervision reforms for social services. So that was an initiative that has been kind of in the works at the legislature over the last couple of years. And then also Senate Bill 90 would direct DHHS to conduct studies to improve social services. So a mix of bills with study bills, but also bills that would, again, follow the recommendations of that Child Wellbeing Transformation Task Force or Council.
Wow, so a lot going on, a lot of bills being filed, and things I'm sure will start to move forward here in the next few weeks.
Yep, absolutely. And we're still anticipating, there will be a new COVID relief bill with the federal dollars that are still left on the table from the last December bill that passed Congress. And that's, before we get to the 1.9 trillion federal relief package that is still, trying to move its way through Congress. So, that will be a really interesting bill to watch and to see what gets funded out of this next round of COVID relief that the General Assembly will put forward in the next week to two. And then they'll start getting to work as well on the state budget.
I have a clarifying question for you, Ashley, that I got by direct message about, I get confused between Senate Bill 36 and Senate Bill 37, but anyway, the reallocating or extending deadlines on the CARES Act funding, you mentioned 155 million to local government. What are the stipulations from the CARES Act funding on how that's supposed to be spent?
That's a great question. We would need to go back and look at that federal legislation. The state bill, as I mentioned, doesn't really have a lot of detail because in most of these areas, like I mentioned with the 1.6 billion on the school funding, the stipulations are all spelled out, in the federal legislation. So we would have to go back and look at that. I apologize. I don't know that offhand.
Great. And then a question from Greg Borum. Any raise the age implementation bills or funding that we should be looking for this session?
That's a great question. I don't believe I have seen any yet. I'm not 100% sure of that, but I don't believe I have because I would flag those bills when I see anything raise the age related. So unless something is slipped by me, I don't think that we have seen that yet this session. We of course did see some raise the age funding during the last some of the supplemental sessions they had after the 2020 short session during that COVID relief session, but nothing that I have seen yet in the 2021 session.
And a question from David Rockefeller. What's going on with House Bill 32 that expands private school voucher program?
Oh, yeah. So that, yes. So that bill has not been heard in committee yet. It was introduced, has some very strong sponsors on the House side. I don't think that there is a Senate companion to that bill, but no movement yet on that bill. But yes, it has been introduced. It would include an expansion on both the main program, but then also expanding the students with special needs and disability scholarship program. It would expand the definition of a child with disability and include any child with a 504 plan. It would also create a special scholarship fund, I think up to $17,000 for those students with special needs. So yes, that has been introduced. It has some very strong sponsors on the House side, but has not gotten a committee hearing yet.
Great, thanks, Ashley. I don't think I'm seeing any more questions come in the chat box, but of course we can keep taking questions through the end of the call.
Thanks so much, Ashley, for the update. We look forward to hearing from you again next week. All right, so next we want to hear from Kaylan Szafranski, the Health Policy Director here at NC Child, who's going to talk to us about some very exciting possibilities that are coming down the line through the federal, through Congress. So Kaylan, take it away.
Thank you so much, Adam, and good morning, everyone. And I feel like very exciting is an understatement. I have been thrilled to read everything coming through a bill that has been put together by the House Energy and Commerce Committee. So the House ENC has a reconciliation bill draft right now that they're going through, and it does a couple of really incredible things on the healthcare side. What I'm going to talk about is mostly on Medicaid, but it's worth mentioning that it also really strengthens access for folks through the marketplace subsidies as well, doing a couple of things like increasing marketplace subsidies so much that for really low income people that are making too much for Medicaid, but would otherwise be in that coverage gap on the marketplace, it helps with tax credits to the point where they would basically not have to pay any premiums, which is amazing. And it ends what's called the subsidy cliff for people that make over 400% of the federal poverty level, who currently on the marketplace don't have access to tax credits to help pay for premiums. And so this would remove that and extend those tax credits for those individuals. So that is exciting, but it's even more exciting on the Medicaid side, because the proposal includes just an incredible incentive for states like North Carolina who have not expanded Medicaid yet. And so what that looks like is it would give states a 5 percentage point increase in and this is going to get a little wonky, but I promise it will make sense. What is called the base federal medical assistance percentage. We call it the FMAP, but essentially what it is it's the federal match dollars that feds send to states to help pay for their medical programs like Medicaid, like CHIP. And so this 5% point increase would be across the entire state's federal match. So not just for an expanded population, which is how they did it way back when they were allowing states to expand Medicaid. So really what this means for North Carolina is a couple of things. So this would happen over 2 years. So this 5% increase of the FMAP would be for a 2-year period. And over that 2-year period, North Carolina would be eligible for $2.4 billion with a B extra dollars for expanding Medicaid, which is incredible. So not only is that $2.4 billion that the state would get that we don't have access to now, but because it would apply, the increase would apply to our full FMAP and not just for a new eligibility category of covering what are often referred to as ACA adults, or for expanded Medicaid, right? Often low income childless adults is what that population looks at. This would apply to our whole Medicaid system. So it would free up state dollars to not only increase eligibility, but really protect from any cuts to programs or services or any constraints that the state might have faced because of things like COVID. So it is like a literal lifeline for the state to get more people coverage. Like I said, it lasts for 2 years. And there's another bonus that they threw into this, as if this wasn't a sweet enough deal. So this also would happen on top of the federal match increase that came with the Families First Coronavirus Response Act that was passed in last March as the first big relief bill package, which provided states with a 6-point percentage FMAP increase for their Medicaid program, and attached some other provisions like people couldn't get kicked off of Medicaid, that no services could be reduced, during the public health emergency. So as long as the public health emergency stays in place, which we know is going to be to the end of this calendar year at least, if this bill passed, and if North Carolina took up this opportunity, we would get this additional 5% federal match increase on top of the increase that already exists because of the Families First Coronavirus Response Act. So that would bump our federal match up from its current 67% to 78% for the entire duration of the public health emergency. So that is even more money to get this done. So that is huge. Now, I know a lot of folks have been already kind of chattering about how it only lasts for 2 years, but there are a couple of things to keep in mind when we think about the duration of this proposal as well, which is in 2 years, we would anticipate, because of economic stability coming back into a healthier place after COVID, that Medicaid enrollment would go down. So we'll see it go up because people are in a tough spot right now economically, but that it will balance out. And that's coupled with the incredible amount of data that supports that states that have expanded Medicaid already see exponential cost savings just across the board on all of their health services, because it is putting more people into access with consistent health care, preventative health services, and really helping them ameliorate their health needs and slowing down things like uncompensated costs. So when people don't have health insurance, they usually wait until something really bad happens, and then they end up going to the ER, and that costs a lot more money than giving them insurance on the front end, so that they don't have to wait until it's an ER visit, and also so that the taxpayers aren't taking care of it because they'd have insurance. So that's just something to keep in mind as we think about, yes, it would end in 2 years, but there is a lot that could be done in that. And $2.4 billion is a ton of money. And North Carolina, in the states that haven't expanded, gets the third highest amount of money from this proposal, after only Texas and Florida having a little bit more funds coming from this proposal. So this is just an incredible opportunity. So exciting to think about. I know that it would still require a couple of things, of course, to happen on the state end, which is they'd have to pass legislation to allow us to expand, which isn't a small lift, and we get that. But I'm feeling wildly optimistic on a Friday afternoon, well, almost afternoon. So I will let that ride. But I do want to put in the chat for everyone, just because it's worth remembering, the Kaiser Family Foundation, with this proposal, just put out state-based fact sheets to talk about who would benefit from expansion. And so this is our newest fact sheet that really breaks down the populations of folks that currently don't have access to insurance, or if they do, they can't afford it. It breaks it down by demographic, and it really helps us understand the incredible need of folks across our state who would benefit from this. And again, if there is no other reason than the almost 350,000 people that would get coverage, we now have 2.4 billion reasons to consider this. So this is moving through the House E&C committee, as I mentioned. If you feel strongly about this, it's probably worth a call to your representative to let them know. And happy to talk through any questions. You know, this is all developing still, but we're keeping close tabs on this.
All right,
Wonderful.
we have questions for you. Sorry, Adam, I interrupted you in the chat box. So just to clarify, Kaylan, all these goodies that you're talking about in this federal relief bill, this only happens if we expand Medicaid in North Carolina, right? So
that is correct. If we can get that done, then it basically opens the gate to all of this for us.
And Michelle Reese is asking, would this have any impact on the Medicaid expansion percentage from the federal government? Would it still be 90-10 with the feds paying 90, the federal government paying 10%?
After the two, yes, that's exactly what the breakdown is. And the way that trigger was originally put in was kind of a accountability measure for states, that they wouldn't, the original legislation, if we really want to get into a wonky Medicaid policy, which is near and dear to my heart, and I'm always happy to do. But the way the original piece of legislation was written was that there was a lot of concern that if states had 100% federal funding, and if for some reason that dropped off or the state didn't want to do this anymore, there wouldn't be any financial incentive that the state put forth to counteract the state just saying, like, actually, never mind, we're done with all the incentives. Now this population is going to lose coverage again. So this was a little bit of a counterbalance that was negotiated when they originally passed the Affordable Care Act. Just a history.
And Terry's asking, how do we refer to the bill? Is there a bill number in the House yet, or are we talking about the American Rescue Plan at this point?
So that is a great question. I can look that up and make sure it's sent around in the notes because I do not have a bill number right now, but I believe if you refer to it as the House ENC bill, committee bill, that is exactly what, where this is being developed. And so they would know what legislation that is. Thank you, Fawn. So it's the Energy and Commerce Committee bill. But I will double check if they have a bill number. I know they're still going through negotiations, but so far this provision of incentives for expansion has been pretty unanimously agreed upon, at least in the committee. It's also worth noting that this is really flagging for us where this current administration's head is at in terms of Medicaid and health coverage for our country. That if this is where they're starting, that's a pretty good place to start. Usually stuff like this gets ratcheted up over time as more and more people are asking for it, and they're starting pretty high up there. So I think this is signaling some positive incentives for states like ours that have not expanded yet to really get that done.
I don't see any more questions in the chat box.
All right. Kaylan, thank you so much. That was very informative, and it is really exciting to see this, and we will be very interested to see what comes through the package ultimately from the federal level, and then lays that again at the hands of our legislature as far as them making the decision on whether or not to pass an expansion bill. But thanks so much. Okay, so we have heard a lot of information today. You all got to hear about the Child Health Report Card. We talked about a lot of bills that are moving in the legislature. Kaylan talked about some federal policy. Do we have any other announcements or questions before we adjourn?
I don't see anything in the chat box, but Adam, do we want to just give folks a quick sense of, with this big federal rescue package bill, kind of where it's at and where it's going? So the House was really aggressive on markup on this bill this week. All of Congress is on a federal recess next week. They're at home in their home districts. Good time for a letter to the editor, y'all, or a call to the local field office. And then they'll be back the week after. They do have the impeachment stuff to wrap up, but we expect this to move pretty quickly through the US House and into the Senate. And once it gets to the Senate, that's really where the ball game is, because you've got such a razor thin Democratic majority there. So that's kind of the timeline to think about. So yeah. And Kaylan sharing a report on the proposal from our colleagues at the Center on Budget and Policy Priorities. And I will share that in the follow-up email that we send to y'all today after this call.
Yeah, and keep your eyes, like Fawn said, we'll share that information. And I think we will likely put out an action alert sometime too, as this thing is happening, where again, once this moves to the Senate, of course, here in North Carolina, that means Senator Tillis and Senator Burr have the votes on whether or not they would support that, et cetera. What we're hearing, and I think what everybody's expectations are, is that we're just going to see a reconciliation bill that probably passes along partisan lines. However, we should definitely talk to and educate our U.S. senators on this issue. And Senator Tillis was part of the 10 Senate Republican Senate group that went and had a conversation with Senator Biden. And, there's been a little common ground there around like childcare, relief funding, et cetera. So I say all that to say, obviously, we advocate. That's what we do, and we'll push for the right thing and let the chips fall where they may. If there's nothing else, then we will adjourn this meeting. Next Friday, we are going to be joined. Let's see, what is next? Next Friday, we talk about Medicaid transformation, which is another huge issue, huge systems change going on in North Carolina. We're going to be joined by Doug C., who's an attorney with Charlotte Center for Legal Advocacy, perhaps another guest. So come with your Medicaid transformation questions. Thanks, everyone. Have a wonderful weekend.